Hello and welcome everybody. My name is Siobhan Carroll and I'll be your host today. Thanks for joining us on today's webinar, Completing Your HIPAA SRA Before the End of the Year. Today's webinar will be interactive, we hope, and should take about 45 minutes. Please submit your questions through the questions box on your control screen and we will answer them at the end of the webinar. If you sent your question ahead of time, we have it and we will answer it during the webinar. We've also created a couple of poll questions to help guide the conversation, so please answer them when they pop up. A couple of quick webinar tips. Throughout the webinar, we'll keep all lines muted to prevent background sounds. After today's session, you'll receive an email from us. If you're interested in a copy of the slides, please let us know. With that, I'd like to introduce the first of our presenters, Vikas Khosla.
Thank you, Siobhan. Appreciate it, and welcome everyone. Glad you could join us today for this really important and timely topic, given where we are at this time of the year. My name is Vikas Khosla. I'm the Chief Digital Health Security Officer at Intraprise Health. And joining me today is Kirk Ising. Welcome, Kirk.
Thanks, Vikas. Just as a way of introduction, I've been around healthcare technology for 14 plus years now, working at different avenues, and excited to be here. It is very timely. End of the year is not just holiday season, but it's HIPAA season. So with that, just a little bit about Intraprise Health. HIPAA 1 as we get started here. We are a certified team of compliance experts. We've got great folks on the team like Vikas who really know what they're doing and understand cybersecurity and compliance inside and out. We've built industry-leading software to pair with those experts, and we'll be talking about that later on today. And I think the biggest thing, and certainly what we hang our hat on and are very proud of here, 100% success rate in responding to and passing audits when it comes to HIPAA compliance. So hopefully that gives you guys a little background on us. We want to get in and have Vikas share some different pieces, make sure everybody's up to date on some of the changes in HIPAA as we build through, and then we'll get into meeting those year-end requirements. So with that, Vikas, if you want to take it back and talk about some of the changes.
Yeah, absolutely. Thank you, Kirk. So yeah, I want to spend just a few minutes talking about what's happening sort of at the regulatory, federal, as well as state level, sort of the macro level trends that really are signifying the importance of doing your HIPAA risk analysis and doing a good thorough job with it as well. It's not only quantitative anymore, it certainly is qualitative as well in terms of performing your annual risk analysis. So one of the things that happened, this was actually last year in the fall timeframe, was that the STAR clause, which a lot of you may be familiar with, a safe harbor was enacted for the particular STAR clause. So for those of you who might be familiar, STAR laws really prevented organizations from quote unquote colluding, if you will, for fee for service type of referrals and recommendations, primarily between healthcare systems, hospitals, and the providers in their community. There were really very strict rules around financial support between these two types of segments in the marketplace, again, hospitals, health systems, and then the providers that were in the community. But CMS and OIG, I think to their credit, recognized that cybersecurity is too important of a topic. Compliance and security, privacy are just too important topics for the communities not to be working together. And as we've seen the consolidation in the space of the provider community between the hospitals, health systems, and the community physicians, they recognize that there is a need for these two entities, these two parts of the ecosystem to really work well together. So the relaxation of the STAR clause really allowed for these two entities, again, I'll give you a practical example. It could be a hospital that's you're partnering with, that you refer people to, or a provider practice that is utilizing services and is affiliated with, maybe even has a formal business relationship with a hospital health system. With this relaxation in STAR, you now can work together very collaboratively on your cybersecurity, security, privacy, and compliance programs. Hospitals and health systems have obviously a lot of resources in terms of experts, technology, technology, other types of tools like a HIPAA 1 kind of a tool. And now with this relaxation, both organizations can work together, and actually the hospital or health system could actually fund a piece of technology, some services to help that practice really do a really good job at their annual HIPAA risk analysis. So there is, again, this macro level recognition at the federal level that all entities that are part of the healthcare security ecosystem need to be able to work together. So this removal really helped to do that. So that was pretty important. Now, if we go to the next slide, Kirk, we'll talk a little bit more about, again, this recognition at the Health and Human Services, HHS level, as well as CMS, that information, healthcare information specifically here in this particular case, is really, really important and critical. So one of the reasons we want to secure this is so that things like the Information Blocking Act that went into effect earlier this year into spring and will start to be enforced next November is really centered all around being able to provide access to health information to patients, unfettered access, quite honestly, and timely access. They recognize that healthcare consumers need to be more educated and need to have more access to their information. And so they are encouraging through this, or really legislating, I should say, through this Information Blocking Act, it's part of the Cures Act final rule, the requirement for entities such as hospital and health systems, but also provider practices to provide this information when requested to their healthcare consumers, their patients, in a very timely fashion. This, of course, requires that this information is also secure, and it's kept private, and it is exchanged in secure and private means. So again, looking at your processes for how you access PHI within your EHRs, and then how you provide that to patients is really, really important. But the underlying sort of the underpinning of all of that is that you have to do it in a secure and private manner. Kirk, let's go to the next slide. So another really huge Safe Harbor Act that was enacted in January of this year was actually the first change in many, many years to HIPAA and HITECH. So this particular Safe Harbor, what HHS did, again, further reinforcing the need for the community, the healthcare provider community, to work together and to work in a very secure fashion, was this promulgation of this particular rule, which essentially pointed to cybersecurity frameworks and the adoption of a framework. So if we think about HIPAA and the HIPAA security rule as having 52 controls and being something that really leads to better compliance and a better security posture, they are really signaling that healthcare providers need to now sort of take even further action to secure their data from a cybersecurity standpoint. And one of the ways to do that is to adopt a holistic framework. And there are a couple of them that are out there that you've probably heard of and know. And we at Enterprise Health and HIPAA 1 provide solutions around framework and framework adoption. But if you do adopt a framework and you can demonstrate that you are being diligent in following these industry security best practices, then the carrot really is that if there were ever to be an audit, there will be some leniency shown in terms of the scope of the audit. Potentially, they would decide based on your information that they don't even need to perform an audit. But let's say if you're in an unfortunate circumstance that there was a breach or there was some other violation of HIPAA, there would also be leniency in terms of the fines that would be potentially imposed. And we know that they can be pretty significant. And again, this is showing that, hey, we are addressing HIPAA from a compliance standpoint, and we are also taking on cybersecurity best practices and moving more towards securing that information. So you can kind of see how all of these things really work together from the federal level, signaling that we really need to be on top of our game when it comes to cybersecurity and privacy. So the topic of this webinar is, time to do your HIPAA security assessment. So if you haven't done one in 2021, it's really, really important that you do it. There's also a financial component to this, as I'm sure a lot of you know as well, which is MIPS, formerly meaningful use. So if you're a provider that's submitting under MIPS and getting reimbursement and incentive payments under the MIPS program, then there is now a hard requirement under meaningful use, pre-MIPS. That was somewhat of a sort of fuzzy, vague timeline as to when you needed to do your risk assessment. Most people, sort of just put themselves on a calendar year to do one annually, but there was some fuzziness around it. Well, MIPS really upped that game and provided a very specific time frame, which is really the calendar year, January 1st to December 31st, in which you have to do your risk analysis in order to be compliant with the MIPS guidelines. And we'll talk a little bit further about it later on, but Kirk, I don't know if you want to share a little bit more around how things have changed under MIPS.
Yeah, thanks, Vikas. It's interesting because the reporting doesn't happen until Q1. We still find folks that think they can do the SRA before they file, before they report, which puts them in January, February, sometimes even in the March kind of time frame. But the way that MIPS is set up is that SRA needs to be completed, not all the work after it, but the SRA, that we'll go through that in a bit, does need to be completed before the end of the calendar year that they are going to attest for. So a big change, and obviously it also moved within that MIPS program from just part of the scoring to a prerequisite, which is, again, following up what you were just talking about, really driving home the importance of it. It is a all or nothing. If you don't do your SRA, you just stop there. You don't get to move on with your filing of MIPS, right? You have to be doing that first before you can go into the calculations and the scoring.
Yeah.
And all this really speaks to the fact that there is a problem, right? Data breaches, HIPAA violations really are happening at an increasingly frequent rate. Vikas, you've talked a lot about all the different rules, regulations, the changes that are pointing towards this. But why is this continuing to happen? If people are doing a better job, what is it that's really driving this?
Yeah, that's a great point, Kirk. So one of the statistics that I really found very amazing is that in the last year and during, through COVID and the pandemic and everything, that cyber attacks, the pace at which, especially ransomware attacks, had accelerated is really amazing, almost fourfold of what they were in the prior 9 years. In fact, one research organization indicated that 34% of all healthcare providers, and this could be hospital health systems as well as practices globally, have now been hit by a ransomware attack, have been the victim of a ransomware attack. And as we know, that that is really some serious stuff. I mean, it can be really messy to deal with. There are potentially payments, negotiations with dark web cyber actors that are involved. Really, really bad stuff. And so, to your point, Kirk, why is this happening? We're getting better. We've been doing risk assessments for a while now. Hopefully we're remediating our gaps as well. Well, really why it's happening is because the bad guys, the cyber criminals that are out there, have really honed in on healthcare. They have focused on healthcare as much as any other industry. In fact, I think only finance leads healthcare in terms of the number of attacks that have been launched against it. And they see the effects of these attacks. They can take down healthcare systems for 3 weeks, 4-week periods. They can hold them for ransom for cryptocurrency, Bitcoin payments of pretty significant amounts. And they can really just cause a lot of havoc on the healthcare system. So the amount of attacks that have been launched are just incredibly increasing, and that really isn't easing up. And again, that HIPAA HITECH state safe harbor around cybersecurity frameworks just is another indicator of how important that this is. And one of the key ways, one of the soft spots, if you will, that the cyber actors have found in order to launch these attacks, quite honestly, are through employees' lack of awareness around technology, computing, security, and privacy specifically. So we've all gotten those phishing emails, which look a little funny, or they may seem very genuine. Some of them are artfully composed. I will give them credit for that. It's pretty amazing. I've seen some of the
Getting
ones.
better, unfortunately.
What's that?
Seems like they're getting better at some of the stuff, unfortunately.
They are getting very, very refined as far as those are concerned. But employees really need to be made aware, and there's this constant training that's really needed, because our practices are the stewards of protected health information. In fact, in the HIPAA rule, in the content, and I read it, unfortunately, the word steward is actually a noun, a very defined term for healthcare providers, practices, everybody that's considered a covered entity under under HIPAA is considered a steward of protected health information. So it's really important that we really up the game here, and that obviously starts first with a HIPAA risk analysis.
Yeah, thank you. And I did want to address, we did a question that popped in, so I want to just address that real quick. Is the SRA required if you're not participating in HIPAA? Short answer is yes, it is, most definitely. It's part of the HIPAA security rule. It's been around for a while. You've got to get it done. And it really comes down to what Vikas was just talking about. You're a steward of the data, whether you're participating in MIPS or not. You have an obligation, just like you are caring for your patients, but to care for their information and their data as well. So yeah, definitely still a requirement.
Yeah, and some of the fines that we've seen have been levied against organizations that aren't participating in the MIPS program. It's really about stewarding that data.
Yeah, and that's one of the things we've seen most common in terms of a HIPAA violation is the organizations not performing an enterprise-wide security risk analysis. And that just means you're not doing it completely. You're not really doing your system, or you're only doing a HIPAA assessment of your digital systems. But the SRA is really more than that. It's not just technical, it's physical and administrative safeguards as well. So again, we do see a lot of fines. About 80% we saw in 2020 were simply because they were not performing a complete security risk analysis, and some people not performing it at all, but by and large, people not doing a complete one. We talk a lot about policies and procedures. Guys, those are absolutely critical. And of course, you got to implement them. You can't just have them sitting there gathering dust or digital dust. I don't know if there's such a thing in your PC, but they can't just sit and be stagnant. They've got to be followed. And of course, training. Vikas just talked about phishing. The number one way to stop phishing is a trained workforce that are trained to be skeptical, that don't just automatically click. That's your number one line of defense. And unfortunately, a lot of times your number one weakness is that workforce. So training is absolutely critical. That said, it's a requirement, but obviously there are folks that still haven't done it, right? And there's lots of reasons. We can always find reasons. It's just like me and getting to the gym, right? I've got lots of reasons why I can't do it, but I still need to. They do take some time, right? Depending on how you do it, especially, it can be a real burden time-wise. Administratively, you've got to get resources in place. Process, how you do it just exacerbates those issues, spreadsheets, emails, getting folks on the same page. Being too busy. I mean, I know we say lack of internal resources. That's a nice way to say you guys are too busy, dealing with everything else, running a practice, taking care of patients. We get it. We see it all the time. Tracking and reporting, right? Part of the SRA, it is not a stagnant thing. It is something you do and then you work off of for a year, and then you do it again. Then you work off of it and keep working on that map. And then the big one, and I think this one scares a lot of people, unfortunately, but there's complexities, especially as you add in a couple more locations or add to your workforce, add the number of systems that you've got to monitor and manage that have patient information, which again, just like an additional location, means it's an additional spot for one of those bad guys to look at. So lots of barriers to it. Doesn't change the fact that you've got to get it done though. It's absolutely critical. So with that said, and we're going to get to the how do we solve it here in a second. Vikas and I just wanted to lay the landscape, if you will, make sure everybody understands and let you know that we understand the challenges that you're facing too. But I want to ask a couple questions here. So if you guys can get your fingers ready to answer just a couple questions. it really is enlightening to know that you guys are in a similar vein to others. So first off, has anyone here on this call completed their risk assessment for 2021 yet? Just a simple yes or no. And we'll give you just a couple, 15, 20 seconds here to respond to that. And it's okay, we're not turning anybody in if you haven't done it. So no worries there. We just want to know, get a good idea of who we're talking to. And again, you've still got time. So if you haven't done it yet, it's probably why you're here on the webinar anyway. So we'll give you another 3 seconds. 2, 1, close that down. And let's see, what are we looking at? So we've got about 20% of you guys have completed it already this year. Nice work, way to be, we love it. That leaves the other 80% that we got to keep working, okay? And that's okay, because you got time still. I know it's getting late in the year. Now to that 20%, I do want to ask an additional question here. Again, we're gonna table the 80% of us that still need to work on it. Those that have completed it, how confident are you? Are you 100% confident that you would pass an audit? Yes or no? Again, we'll just give you a couple seconds here. 3, 2, 1. What are we looking at there? Okay, and this is pretty, it doesn't always look the prettiest, but it is common. 3/4 say they were not confident. We got 1/4, you've done it, you're confident, I love it. That's awesome. But again, it is complex. There's a lot to it that, did you follow it right? Did you really understand what you were doing? Some folks got it in a bunch of different spreadsheets. Do you have the right stuff? It's all part of the puzzle, and we really get it. Our goal is really to take the burden and the stress, help you with those that have done it, make sure you're more confident, and make sure that you've got a partner that helps with it, okay? And then finally, one more question for that last group, or if you're in the other group that haven't done it this year, but you did it last year, how have you done it most recently? Did you do it internally on your own? Did you have an external assessor group come in? Or again, if you haven't done one in the last 21 or 20, please, just let me know. So again, this is for the group here. And we'll give you just a couple more seconds. But again, last year or this year, when you completed the SRA, how'd you get it done? And we'll go 3, 2, 1. All right, so about a third have done it internally, about 20% with an external assessor, and then you've got about 40 that haven't done it. Okay, so the interesting thing is those aren't surprising numbers for us. We tend to see that. Again, you're always making decisions, budget versus time, it all matters, and we get that. So what we want to do really quick is just, let's talk about a couple of your responsibilities, and then we're going to get into the nitty-gritty of conducting an SRA and how we've built a system to make that easier, okay? So SRA, HIPAA Security Risk Analysis, all mean the same thing, okay? Why is it such a key? Talk to people all the time. Well, I've got the patient signing forms. 2 thumbs up, that's great, it's critical. Why is the SRA so darn important? And I get asked this a lot. But this is really, as a healthcare provider, has to be a foundational piece to your cybersecurity and your HIPAA, initiatives, your goals there. And the reason is it creates a known entity out of your HIPAA compliance. Because if we're going to make anything better, we got to measure it, know where we're at. And that's what the SRA is designed for. Be that roadmap, identify where you're at today, create a plan for how to fix it, and then review your plan next year. Make a new plan, noting your changes internally, plus HIPAA changes, plus changes to the bad guy. Okay, that's why it needs to be a continual process. So it really is that foundation. Triggers. Okay, we've talked a lot about MIPS, calendar year, getting it done. Obviously, you can see that down there at the bottom. That is certainly, if you're in that program, get it done by the end of the calendar year, 100%. But there are other triggers, general HIPAA security rule requirement. Outside of that, if you have a breach, do it right then and there. because you want to show that due diligence, because an audit is likely coming. Even if you completed one 6 months ago, do another one now so that they can see that due diligence, they being the auditors that are going to come in. Obviously, cybersecurity hygiene, absolutely critical, right? Just in general, you've got to be doing something. Like Vikas was talking about, these increases in the breaches. This is your step you take to keep ahead of things, to keep checking, to keep making sure that the new computers that came in, they're on the same program as the old one, and it's up to date with the latest. You've got the patches on. You're making sure you're training new employees and doing background checks. All those things need to be very intentional, and the SRA really helps define that and check where you're at. Now, as far as your responsibility here, Vikas, if you want to touch on this, I think it'd be great from your perspective as that cybersecurity and HIPAA expert. What do you see as the main responsibilities, right, on this slide?
Yeah, so Kirk, really, the responsibilities are pretty clear for provider organizations. So a security risk analysis is not a one-time event. And in fact, I like to promote this idea with folks and clients that we work with of focused risk analysis. So you have that risk analysis that you've got to do under HIPAA and MIPS every year. That's the full enterprise-wide one that you referred to. But there, you notice that the law really says conduct regular security risk analysis. So if something has changed in your environment, that could be a new EHR, that could be something that's related to locations and physical security. It could be related to new staff members that are coming on board or leaving. In fact, those that may have done a lot of work within your organization have access to different things. Then I really promote this idea of doing a focused risk analysis. You don't need to do another big one all over again, but you do need to do a smaller one that focuses on that potential area of risk that may have emerged for the various reasons that they could. But it's really, really important that once you do your risk analysis, that you have a good remediation plan in place. In fact, auditors, that's the number one thing that they look for is, are you being diligent in remediating your risk? Now, that doesn't mean you need to solve and fix for everything, but what it does mean and what they're looking for is to see that there is constant activity. You're working on remediating your gaps that were identified during your risk analysis. And of course, Kirk, you mentioned it earlier, policies and procedures, table stakes, right? We have to have good policies and procedures. We have to implement them properly, and then we have to keep our staff trained on an annual basis. So in fact, on the HIPAA One platform, there's a training module that would help you comply with this requirement around training. And it's just good, again, cyber hygiene. The more intelligent your folks are about security and privacy, the less risk to your organization. And all of this needs to be documented. So again, if there ever is an audit, whether it's OCR, whether you call an external auditor, more and more payers, business partners are presenting you with security questionnaires. I'm sure a lot of you experience this. They're going to want to see documentation that shows that you're doing your risk analysis, that you have an active remediation plan, that you have good policies and procedures, you're training your staff. So a central source that you can really point to and pull information from that documents your security program, right? That's really what we're talking about. It becomes really, really key and essential at very critical times, as I've mentioned. And then having business associate agreements. So part of our platform includes a business associate management module. It's included in the subscription of our product, where you can really centralize and organize and keep all your BAAs up to date, those business associate agreements that you need to have with your various business partners that access, either directly or indirectly access your patient's information, your PHI. So that's a really good, solid program. And if you are ever audited, these are the things that they're going to be looking to see that you're doing well.
Yeah. That's awesome. And I like to think of it as intentionality for a lot of this. You talk to folks and they've got good firewalls and they're encrypting their emails, but HIPAA really wants to see that it's done intentionally, because if people in the organization change, are those practices going to be maintained, right? Be intentional with your HIPAA compliance. And that's what HIPAA really drives at with all the documentation requirements, et cetera. Absolutely incredible, you know, really, really critical in that regard. So with that, hopefully Vikas and I haven't scared you guys too much, right? It's complex. There are pieces to do it. The SRA is Vikas pointed out, 52 different things you've got to check, literally 52, not just throwing a big number out. How do you do it? If you haven't done it for this calendar year, you need to get it done. How do you get it done in time? Holy cow, the holidays are here. We got Thanksgiving to plan, hopefully some football to watch in there, you know, and then you got the big one at the end of the year. So time gets short, right? So that's really a big piece of what we want to talk about today, the HIPAA One platform, how you can get through that quickly and completely, because that's the key. Just throwing something up isn't going to help you out. But if you do a good, complete SRA, and the system makes it much easier, then you're safe. Even if you've got work to do, you're showing that intentionality, the due diligence, you're taking the right steps. And if an audit is to happen, you're in good shape, okay? Even if you've got work to do. So we're gonna break this down into just a couple main steps here and walk through this. Again, fire away questions if you have them, and we'll try and get to those as we go through. If not, we'll catch them at the end. But gotta gather data, okay? So the system's gonna allow you to add delegates, which means you can diversify, you can delegate some of the work so one person's not trying to do it all, which is absolutely key. I say it's key in some smaller practices, and we work with practices that have just one practitioner, one person in the office, and that's it. You know, get the brother-in-law to help out with the computers. We're there, we've been there, we know how to help you. And we also work with organizations that have several hundred locations, thousands of employees. HIPAA applies to all of you. The system here is systematic in its approach to make it work for anybody. So where possible, delegate, get the experts on HR, on the network, on the servers, get those folks involved, okay? And again, track the progress. Wait till those bars get green, really high level, simple to track. Got to answer each question, okay? Here we go, talking to primary location with a specific system. Are you compliant? Okay, yes or no? We'll get to not reasonable in just a second. When you click in here in the platform, we're going to show you the details that some might care about. Vikas probably loves knowing what the HIPAA citation is or the NIST reference. I don't care. I'm going to answer the question, right? I'm going to focus on does the organization have a policy and procedure with a formal process? Okay, that's me. On the right hand though is for Vikas and the folks that are smart, and they're going to read the actual citation. Okay. The key is, are you doing it? Do you have it? If you do, see the red box there? Upload it. You can't just answer yes or no. You've got to put proof in here. Absolutely critical. If you don't, that's fine. A no is an acceptable answer when you're doing a HIPAA SRA. That's how we identify where the gaps are. With our platform, if you don't have a policy and procedure, we got you covered with a template. Okay, Word document, you can update it, you'll be in great shape. Don't do it at this stage though. We see it too often where people hate answering a no. For some of us that really prided ourselves on those A grades in school, answering no is just painful. Others, they're happy with it and they're moving on. Right now, when you're doing the SRA, especially time crunch wise, you got to be okay with it. You're going to fix that in the remediation. That's again the point. We're going to identify and then plan. All right. Now, there are occasions where you can answer not reasonable and appropriate. That is not a get out of jail free card. You can't do it all the time just because it sounds easier. Vikas, can you explain that just a little bit, where that makes sense and what kind of explanation is required?
Sure. When the HIPAA rule first came out, security rule first came out, they talked about this concept of an addressable finding or an addressable control. And a lot of people sort of interpreted that as being optional. Well, it's not optional. What they're saying is that each of these 52 things need to be addressed and secured and done, but there are different ways of doing them. So for one organization, Kirk talked about thousands of employees and many, many locations, the way that they address something is going to be different than where maybe a smaller provider practice and what their resources are, how they do it. So again, it doesn't mean that you can ignore it and that it's optional. What it means is that there's flexibility in the HIPAA security rule, addressability, if you will, as to how you do it. And so size it for your type of organization. So you just have to identify that this is an addressable finding, and these are the steps that we're taking in order to address this particular finding. But again, here, key is documentation, the notes, that you keep this up to date and explain what you're doing. So if an auditor were to look at it, he'll understand that you're being diligent and trying to comply with the law by taking some action that's reasonable, appropriate for your size, your type of organization.
Perfect. I appreciate that. Yeah, again, documentation, right? We need to know where you're at, and you need to be able to back that up. So at this stage, right, everybody's gone through. If you've got 5 or 6 people involved, or if you're doing it all yourself, you've got the information in. Honestly, where you got no, where you got yes, you put it in here. You add notes that help you later on down the road make plans. But then you got to go to assessing, right? Make sure that what you put in there is compliant. That the software gives you some guidance. If you need it, we've got our team of experts that can help. We got to figure out exactly where you're at, and then it's about what are you going to do with that information, right? Planning. Our system is great. You've got to define each area that's not compliant needs to have a risk level, high, medium, or low. The system's going to compute that for you. And that's not just to say how many high risk items I have, right, and scare yourself. What that's about is planning. You got to get to those items first. You don't want to spend a bunch of time on a low risk item. If you've got high risk items where damage can really be done and be done easier, you need to jump on those first. So that's the way the system prompts it, going through high, mediums, and lows. And you're going to click in, and each risk, right? Again, we talked about this big complicated thing that is HIPAA. Hopefully you're noticing that what we've done is take that and just start applying step-by-step work to it, right? Building a remediation plan sounds like a big deal, and it is important. But if you take it step by step, which is what the system's going to drive you to, anybody can manage it, from the small to the large. Anybody can manage it. And it is a matter of just going into each risk. You're going to include the top 3 items completed for you. The bottom item, even the action plan, is also pre-filled. Now, it's pre-filled doesn't mean that that's the end all be all. It is an editable box, and we encourage that. Make it fit you specifically, but we didn't want you to start from scratch, okay? And then you'll see the arrow by compensating controls, assignee, and target date. I'm going to address assignee and target date real quick, and then Vikas will have you help with compensating controls. Because for some of us like me that don't live and breathe cybersecurity like that one can be confusing. But somebody has to own this. That's your assignee. The system defaults to whoever answered the question to save you time, and if that's the right person. And they have to have a target date. And we give you some guidance on time, but there needs to be some accountability there, and that's a key, assignee and target date, and the system's going to force you to put those in. Vikas, can you take just a second and explain compensating controls for the folks?
Sure, and it's somewhat related to the topic of addressable items that we talked about earlier. So compensating controls really are those things that you're going to put into place to remediate this thing that may be supportive of a full remediation, a full resolution, but maybe not 100%. And again, there's that flexibility in HIPAA that it provides to organizations to say, hey, maybe I can't make this action plan item, this direct, what we're recommending, do it exactly the way you want me to do it, but here are some compensating controls that we can put into place to help further strengthen and lower the risk associated with this particular action item. There are a lot of, physical security that tends to be a place where there's a lot of compensating controls, as we know that there are 3 primary portions to HIPAA in terms of technical, administrative, and physical risk. So you tend to find this a lot there, as well as in the technical controls. So, not everybody can afford to have very, big, fancy, very sophisticated firewalls and cybersecurity prevention tools and things of that nature. But what else are you doing to compensate for this particular risk that's been found?
So can you kind of sum it up by saying like giving yourself credit for what you're doing right? Is that?
Yeah,
Okay.
absolutely. Yeah, for sure. That's a great way to put it.
Perfect. Thank you. I appreciate that. All right. So now we've gathered data. We've identified those gaps. Now we're going to create this remediation plan, right? And now it's finalizing, right? Go back through, make sure you got it all right. Make sure the prioritization's right, those target dates, things are assigned, and then you're going to finalize, okay? And in the HIPAA platform, once you finalize, it's a little bit of a whew, got it done, especially if you're hitting the deadline, right? This is the point you've got to get to satisfy, if you're doing the MIPS program, you got to satisfy to this point, finalized, signed before the end of December 31st. Okay. Hopefully you're not doing it that week. Nobody wants to be working on HIPAA in between Christmas and New Year's, but you wouldn't be alone if that was you, unfortunately. But the work doesn't end there. As we've talked about a lot, this is an ongoing process. So now into the new year, if we're looking at today's timing, now you get to start working on those remediation items. They don't have to be done before the deadline. They can be spread out, fit in easier with your day-to-day in the first half of next year. Depending on what they are, maybe they take a little bit longer, and that's okay, but they have to be worked on and documented, all right? So we've got this dashboard, gives you a high level, is action happening? And that first button there, action plan, brings you into this page, and this is where you track it. Because again, the documentation, if you're just on spreadsheets, how do you document it? Does everybody document it in the same place? Well, in HIPAA 1, you're going to centralize all that, whether you've assigned it to just you or whether you've branched out to 5 or 50 different people working on it. Everybody can get their own login. They need their own login at this point, and they'll document their progress or that it's complete. Okay. Really meeting that documentation requirement of the HIPAA security rule. You're going to be able to prove your due diligence. If you just do the SRA and stop, you got a little window there where, hey, you did good stuff. Now we got to see action. If there's no action happening, we had a practice get visited by the state attorney general. They turned in an SRA and then they wanted to see progress. So they turned in the next SRA and it was exactly the same. They didn't do anything with it. Well, that shoots the whole program down, right? That's not the point. You've got to track it. System makes it easy. All the context from notes, all the downloads, all that's available right here. Just click the risk number and you've got it. Simplifies it, makes it easier to delegate. Again, trying to make life a little easier and to keep it documented. And then the report, you've got to have a report that documents this, that documents the plan, the due diligence, all that. All that's built for you in the HIPAA 1 platform, including methodology, all that boring stuff that we're never going to write on our own, but an auditor likes to see and makes them happy. Happy auditors fine less. That's a proven fact. I'm sure there's lots of research on it. So we do try and keep them happy in that situation. And so the report is complete and you can download it, grab it as many times as you want. And that's what you've got to do, right? That's where the system takes it, really builds through it. People ask all the time, how long does this take? Okay. We can give you a good idea on that first stage where you're gathering the data. This is what we see for each of the roles. Now, doesn't mean everybody gets to do their own. You may be doing them all, or you may divide it up between a couple folks in the organization. But this is what we see for each of those groups, as some are longer than others. So you've got a few hours there. Then you're going to have somewhere in that range, probably in step 2, and then finalizing for the plan. But this gives you an idea that this is really doable, and we can help you get it done. All right. Again, working with HIPAA 1, we do have experts. You can reach out and ask questions as you go through, so you're not on your own. Okay, that's a big key thing. And in fact, we really have 3 main approaches. We have a self-assessment, like a TurboTax, right? We use that comparison probably too much here, but it's great because taxes are complicated and so is HIPAA. And there's software that makes it easier. So you can do a self-assessment. We'll do a kickoff call with you, even though we call it a self-assessment. We're still there to answer questions and help, right? You got all the policies and procedures if you need them. We even include a vulnerability scan on your network, which is great. It helps check off some of those boxes. Then we have a facilitated remote assessment. this is where you're going to gather data, but you want an expert, like somebody on the cost side of the fence that really knows HIPAA to evaluate what you're doing and make recommendations on how to fix it. Absolutely critical to get that third-party view from time to time. And then we even have a validated assessment where people are just too busy and they want somebody else to do as much of the work as possible. And so that's our white glove approach, if you will, validated assessment. Now, timing is always important, right? We are coming up towards the end of the year. Vikas, what are you seeing really people doing this time of year?
Well, really, given the time frame, obviously the short time frame that we have left, we're really seeing most people going towards the self-assessment or the facilitated remote assessment. Remember, in a validated assessment, the white glove approach, our auditors have to come up to speed in terms of your whole program and history, and then kind of go through and make sure they're answering everything appropriately, getting your validation and checking on that. It just takes a lot more time to do a validated. Quite honestly, that's just not enough time left by the end of the year. So most people are taking the self-assessment approach and the facilitated remote assessment approach. And again, remember, if we're doing a good job and using a system like HIPAA 1, we can come back to things in January where we want to maybe take it to the next level, or you want to sort of upgrade into the validated assessment. We can look at options like that. But most people right now are doing the self and the facilitated remote.
Sounds good. Makes a lot of sense. And you can see kind of the need to know is the information we like to have before we can help you out if you're interested. That just helps us look at scoping the project out, and it's pretty quick call with that information. With that, that's really the end of the formal slides. We're happy to take any questions. We'll open up a poll question here. Those of you that would like us to reach out, or if you don't have questions, don't want to hear from us, that's fine too. Hopefully this is helpful. And we'll give you a chance to click A, B, or C there. And then while you're doing that, if you have any questions, please chat those into the box and we'll get them. Vikas, anything you'd like to add at this point while people are answering that?
Yeah, so certainly want people to answer this particular question, but we do have a couple of questions here. So, and I think I can take the first one, which is, do I need a Chief Information Security Officer for my organization? So the answer to that is that under HIPAA, there is a requirement for a security officer, an assigned named security officer. So somebody by name has to have that particular designation, but that doesn't mean you need to go out and hire an expensive CISO, as they're called, Chief Information Security Officer. Doesn't necessarily even mean that you need to go to a firm like ours and hire an expert, and you really to serve in that CISO role. What it means is that you're doing the right things. There's training, there's awareness, there's other things. Somebody has point over this particular initiative and security and privacy in general. So the answer to that is no, you don't need to hire a CISO, as it were, but somebody does need to be assigned the security responsibility within your organization.
Awesome. And we'll go ahead and close that poll out too. And then we'll see if we have any other questions there.
Kirk, you want me to give you another question here?
Yeah, if you've got one, let's fire away and help folks out.
Yeah, so maybe I think this is a good one for you, Kirk. Is it better to do an internal or external assessment?
Yeah, internal or external SRA, you mean? Or sorry, I apologize, I missed that. Yeah,
as assessment.
So I mean, either one, right? The key is to do one first and foremost, and then it becomes when I talk to folks, there's budget and there's expertise that play in a perfect world where you've got the budget and the time, you have a third party come in and look, just so you don't have the fox guard in the hen house. It's funny, we have assessors that go on site from time to time, less recently obviously, but you'll go and part of the security walkthrough are the doors closed and locked, and they'll be walking with somebody from the organization and they'll want to walk up and kick out the doorstop and let the door close and then say, yep, it's closed all the time, right? And so it's nice to have a third party that can be honest and just say, hey, I'm not, no axe to grind, not trying to make somebody look good or bad, but can just be honest, right? So in a perfect world, that's certainly the way to go. Not to mention having an expert who really knows if what you're doing is compliant or not when you're close. But Barring that, you use a platform like HIPAA 1 and you can do it on your own, and you'll be far better off than not having done it. Hopefully that wasn't too windy.
So Kirk, I got another one that I think is good for you. So can I use the HHS spreadsheet HIPAA security questionnaire to comply? I assume the assumption here is and still be considered compliant.
Yeah, great question. So probably is the answer. I recently, this is always fun, but so I breed puppies, and I had a dog that got out at the wrong time, and so I had some free puppies to give away. And I always like to compare that tool to one of those free puppies, because that free puppy still needs food. You still got to go to take it to the vet, etc. There's a lot of costs and time associated with it. So can you? Most likely, probably get there. But you're going to spend a lot of time and resources, and you've got to have some expertise in what HIPAA is to make that work. And even then, it's just not efficient. So long answer is you can probably get there, just like you can, ride from Venice, California to New York City on a bike, right? It's just going to take some work along the way, but it's a lot more efficient to get there on an airplane.
Well, terrific. All right. Well, I think it'd be great to give folks a little time back to transition back into the other several hats that they probably have, or to their next meeting. So it was a lot of fun here, Kirk, today. Enjoyed doing the webinar with you.
Yeah, I really appreciate the help, Vikas, and lending your expertise to the call.
All right, terrific. Have a great day, everyone.